The apexum procedure is a new approach for treating periapical lesions. It is designed as a complementary step after standard root canal treatment. Periapical lesions are found in 20 to 60% of all dental patients. At present, periapical lesions are treated by conventional root canal treatment only, without directly addressing the issue of the lesions specifically. The apexum procedure is applied upon completion of root canal cleaning and shaping, whereby an apical patency of up to a number 30 file is achieved, creating a passage to the periapical area. Then an apical stop is made by using a number 40 file, positioned at about 1 mm coronal to the apex, thus creating an apical stop. The apexum kit includes 2 ablators, the apexum coarse and the apexum fine, and 2 irrigation needles. First, the apexum coarse ablator is inserted through the canal up to the previously created apical stop. The apexum coarse ablator consists of a blade made of shape memory nickel titanium, encased in a nickel titanium sheath. When extruded through the sheath and into the lesion, it assumes its predetermined retrograde shape. The apexum coarse ablator is then rotated at 250 RPM for about 30 seconds to roughly grind the lesion tissue. A first rinse with saline using one of the provided irrigation needles is then performed. Next, the apexum fine ablator is inserted through the canal. The apexum fine ablator consists of a strand of superelastic nickel titanium filaments and is very flexible. The apexum fine ablator is now rotated at 8,000 RPM for about 30 seconds, further mincing the lesion tissue into a fine suspension, while leaving the bony crypt intact. A second rinse with saline is then performed. Once the backflow fluid appears clear, the needle is removed. After the procedure, a standard root canal filling is completed. Clinical studies show that the bony crypt heals much faster and more efficiently than after standard root canal treatment alone. As published in the Journal of Endodontics, the studies demonstrated that using the apexum procedure in conjunction with standard root canal treatment resulted in 95% healing of periapical lesions within 6 months, a result unattainable with standard root canal treatment alone.